Hello, everybody. This is Dr. Dan Cordalicchio. I want to welcome you to the Destination Health Podcast, powered by the Suburban Wellness Group. We have a really special guest on today. I'm looking forward to this conversation. Dr. Jason Littleton. Dr. Jason, thank you for being on today.
Thank you for having me, Dan. It's really an honor. It's a pleasure to be on. I'm really grateful to be here.
Thank you very much. We're going to have a great conversation. Dr. Littleton is an MD, board-certified family physician, offering concierge healthcare in and outside of Central Florida, chairman of the Department of Family Medicine at Orlando Regional Medical Center, and one of Orlando's elite doctors, as recognized by Orlando Style. He's been on Dr.Oz, the Dr. Nandi Show, Dr. Leaf Show, Fox News Orlando, all over the place. Magazines, Red Book, Parade, Prevention, Ebony, Orlando Sentinel, Orlando Style, InTouch, and Health and Beauty. You do it all, Dr. Jason.
I'm so grateful for the platforms I've been on, and really just to get an opportunity to talk about wellness and really just to share my message of how people can just live well and live strong. It's so grateful to be able to be on this podcast and talk with you. I mean,
Thank you.
Honestly, I just enjoy conversating with you, and even the things that we've talked about as it relates to our background in sports and our children, things like that. Right. It just plays into having a healthy life, and it to me, that's very meaningful.
Yeah, thank you very much. For the listening audience, Jason and I are becoming friends, and we've had multiple conversations about various topics offhand. But the first question I have, traditionally trained allopath, we were just saying that before you came on, but you do health and wellness coaching. And,
right.
And I think that's an important aspect for everybody, no matter what type of physician you are, because it's becoming more and more, recognized that you need health and wellness coaching. Tell us about the health and wellness coaching that you offer.
So, with Littleton Concierge Medicine, not only do I take care of people from a primary care fashion, but I offer wellness coaching, because here's the thing. When I started in medicine, and at that time I was in public medicine, I like to call it public medicine, but really it was insurance-based, where the average primary care doctor is seeing between 25 to 30 patients a day. And you're seeing each patient in a 15-minute slot, new patients in a 30-minute slot. You don't have a lot of time to talk about health and wellness. Really, you have time really to make diagnosis, treatment, and give them a pamphlet. I remember having times where I just felt burnt out. I felt like the patients that I was seeing, change wasn't happening. I felt like when it came down to the nitty-gritty, the numbers like cholesterol, hypertension, weight, blood sugar, those numbers, the needle wasn't moving.
Right.
And I realized that what it really came down to is important and crucial lifestyle modification. And so I realized that I needed to give more of myself to my patients, but I needed more time to do it. And so here we are now in this concierge medicine model, private model, where I see, believe it or not, most people are astonished when I say this, I see at maximum 4 people a day.
Right.
I spend about an hour with each person.
Right.
Now, these patients, they pay an annual membership. But in this confines, not only can we talk about diagnosis and treatment from the allopathic sense, but we can really get into about diet. We can get into wellness. Now, this is what I have found really causes people to make a change in their numbers. When you really start incorporating, okay, wait a minute, it's not just about, diagnosis and treatment, here's a prescription. Now we're talking more about, hey, listen, what are you doing in terms of your lifestyle as far as eating? What are you doing as far as your fitness? How do your habits translate to improving your numbers? Are you moving forward? Are you moving in the right direction? Right. And that's where the health and wellness coaching comes. And I have found when we really integrate, your lifestyle living with your metrics, with your primary care health, now the ball starts moving.
I think that's great, because I'm finding more and more traditionally trained allopaths are moving towards a health and wellness coaching. And I find that fascinating. I have multiple offices in New Jersey, one of which is with a board certified internist and and she's also board certified in obesity medicine. If I don't mention her name, she's going to get mad at me, Dr. Flaxina. And then I have another partner who's a surgeon, who's a board certified urogynecologist in Southern New Jersey. And we make it where those 15-minute slots, I can't do that anymore, Jason. It's really bad because I feel like I'm shortchanging patients. As I'm with a patient for the new consult. It's an hour and a half to 2 hours. I want to know everything. I'm changing their diet. I'm making those positive lifestyle changes, changing those habits, which are extremely, extremely important. Now, when you make diet modifications, what are you doing? What are you recommending?
So, back in 2012, when I wrote my first book called Wellspring, The Energy Secrets to Do the Good Life, as I'm writing and I'm thinking about my philosophy I wanted to communicate with my patients, I came really across my thoughts and put them together and connected the dots this way. I made an acronym called MEDS, Move, Eat, Drink, Sleep. And that acronym that I created back in 2012 really encompasses my message to my patients and clients worldwide. And this is where I just felt like when it came to essential health laws, so to speak, movement, eating organic food, drinking good hydration, water, good squeezed orange juice, whole foods, and then getting appropriate sleep made all the difference. And when I thought about my own life, when I was going through medical school, then residency, we would this is back, like over a decade ago, where the laws were different than they are now for residents. Where now they have like 12-hour shifts, but back then we'd do 30-hour shifts. We'd be up all night, have to be focused, have to make sure that we're making right decisions. And that's why they do that. They really test your mental fortitude, because that when you're in an emergency situation, whether you're tired or not, you have to respond.
Got to perform.
In those situations, I feel very tired. I just didn't feel like, at my best health-wise. And I realized that, wait a minute, if I'm going to continue, if I'm going to keep up with this pace, I've got to make some changes. So I realized that what was essential for me back then in terms of my health is, hey, I need to make sure that I exercise. I want to make sure that I eat elite foods. Some of the things we'll talk about, I'm sure. I want to make sure I hydrated well. And then I got good sleep. I had to make sure that I found what my sleep number is. And that's something that we could talk about later, but everyone has a number, so to speak. I would try to push the needle and try to make sure, maybe see if I can get in a routine of only 5 hours a night. Let's see if that works. Now that didn't work for me. And I would try different things, but I realized for me personally, I had to sleep about 8 to 9 hours so I could be fully effective, but everyone's different. And so basically through medical scientific knowledge, experiential knowledge, understanding what it took in terms of myself to be at my best, and then extrapolating that for my patients, I realized that acronym, Move, Eat, Drink, Sleep, can make a world of difference for people and their health and well-being.
I love that. MEDS, Move, Eat, Drink, Sleep. Sleep is so important. I ask that, do you get deep, restful, restorative sleep? Because without that, right, Jason, those biochemical pathways, your metabolism is not working. So no matter, even if you ate the organic foods during the course of the day, if you're not getting good sleep, it really is you're going to get poor health. And as a matter of fact, now that I'm looking at this, you hit 4 pillars to keep the table standing. Am I right or am I wrong?
Yeah. No, you're right. And, that's what I call the essential health laws in my book. And so that's, again, this is where it's so important. And what I have found when it came to movement, we'll just start there real quick. When it came to movement, I found that all too often I was seeing that patient or that client that hadn't exercised in a while, but they wanted to engage in this major endeavor. And most people think about, okay, I have to exercise for 30 minutes. I have to go ahead and get a trainer, exercise for 30 minutes. But what I found is that most people were not successful doing that. They would start week 1. They were at the beginning of the year. So January, people would get in the new fitness club or start a new routine. They would start week 1, but they couldn't reproduce that week 2, week 3, week 4. So what I've told patients, to their surprise, a lot of times, I said, listen, no. 5 minutes. I want you just to give me 5 minutes 3 times a week, or 15 minutes in a week of cardiovascular exercise. And let's move Neil there. And be like, wait, no. Hey, Dr. J, I can do more than that. No, I don't want you to do more. No, I just want you to follow the instructions. 5 minutes, because my whole point here wasn't necessarily changing numbers in this venue. It was about developing a routine, a habit. And I wanted them to be able to do 5 minutes, follow the instructions. Week 2, fine. We could add on a couple minutes until it became rote memory, so to speak. It became automatic pilot, so people would be able to reproduce that. That's the most important thing, because their consistency, what I was trying to teach them, was the vehicle to actually get them to where they wanted to be. Their numbers changed, whether it was weight, blood sugar, hypertension. Right. That was the whole point. So I usually tell people, look, you give me 5 minutes 3 times a week, we'll start there. If you can master that, and some people struggle with that, but if you can master that, right, then we can move you on and push the needle. So I always start there. It might seem very basic, but I find what it comes to is that you have to develop that routine in your life.
Absolutely. I love this because I have the same philosophy, because in the beginning, without having all the clinical experience that you and I have today, is that, yeah, go ahead, walk for that hour and a half. And patients became resistant after a while, because if they missed a day or two of that, they felt really bad about themselves and they weren't able to continue on with that. But you're right. I have a cardiologist that we work together. And I'll do the nutrition. Of course, he does the cardiology. And we talk about, the patient. It's always HIPAA compliant. And what happens is that we'll say to them, depending upon where they are, get your dog. Do you have a dog? Go walk your dog 5 minutes out, 5 minutes back. Yeah. Start and get that habit going, and get that where then we can add on a little bit more each and every time, so you can build up your cardiovascular system. Maybe we'll start having you do some push-ups, right?
Well, yeah, we would get into those things, but it always still started there, because I told people that the core of any workout should be cardiovascular exercise, working on your heart, working on your lungs, moving that lactic acid out of your muscles. And, this is the thing. Now, listen, if a person says, hey, I walk for 5 minutes, Dr. J, well, I'm like, you could do more than that. Now, I'm not talking about time. I'm talking about you still have to get your heart rate moving. You have to get your heart rate 50% the resting heart rate. So right. If a 70-year-old came to me and said, hey, I walk 5 minutes, I'm giving them a high five. Right. But if a 40-year-old told me that they just walk, 5 minutes, like, no, listen, you gotta move a little bit more.
Right.
And I always teach people that you get your heart rate up greater than 50%, you're resting between 50 to 80%. That means that if your heart rate, resting heart rate 66, you want to get it to at least 99. You want to at least push right. to 99, because that's where real change starts to happen. And so I'm going to push people, but right. I'm going to have them do it for a limited amount of time until they build that habit, and then we'll go further.
Right. I love that. And that's exactly right. Everybody's different. So if you did have the heart attack, you're not going to run a marathon tomorrow, right? You're going to...
Well, that's not the point. You have to actually right. learn how to exercise again, learn how to walk again. You have to take small steps. I mean, it's a play off my name. I always tell people little changes make a ton of difference, or Littleton. And I tell people that because, one, it's a good way in terms of marketing, of course, but it's a good way to remember that you still have to make small changes. We're so sometimes into big things. Nothing wrong with that. I'm into big goals, but the way to get into big goals, especially in your health, is to take those little steps. And you hear people all the time say that. Okay, great. But it's true. It's a principle. And if you follow principle in terms of getting to your overall goal, you can get there, but you have to be consistent, like we said again.
I love this. Yes, you have to be consistent. And for our listeners, that's what you want to be, is consistent every single day, because those little goals, those little micro goals, they add up big over a year. Next thing you know it, you lost 40 pounds and you're feeling better. Your blood pressure is normalized. Your lipid panel is better, right?
Right.
And yeah, your fasting plasma glucose, which is your sugar, right, is better. It's better because these are right. chronic lifestyle diseases that we're dealing with. And yes, genetics comes into play also, but
yeah, definitely family history. But right. I will say, Dan, listen, and I started my book off this way, that what we're talking about are health principles. There are a lot of different diets right. out there. There are a lot of different, trainers. And look, a lot of the information, a lot of different things that are coming from different trainers and books are helpful and can make a difference. But here's the key about all those things. Those things only work because they're playing off certain principles that make a difference. Taking small steps, getting your right. heart rate up, consistency. If you don't find those principles in whatever diet or trainer that someone's trying to convey to you, then it's a fad and it's not really going to help you to be better. There are certain principles that you want to
Yes.
make sure that you see, because again, there's a lot of great information out there, and I don't deny that. I'm not the only one helping people with weight. I'm not the only one helping people with their blood sugar or hypertension. But what makes me different is that I really try to focus on the principles and throw out all the other stuff so that we can move the needle. I'm very principle centered. And being an allopathic MD, being a medical doctor, I'm thinking about the labs. I'm thinking about the biochemistry. I'm putting all the dots together.
Absolutely. And I think that's important that you said that, because I think no matter who you go see, you need to see you or I, right? You need to see us, because we're going to run the labs and we're going to see what's going on. And we want to make sure that you're able to get that and move that dial. And it's not that it's wrong seeing a personal trainer, but we want to quantify it. We want some data to make sure that what you're doing is actually helping you out. I think that's important also.
So important. So important. I mean, we have to put everything together. What's really big for me is I look at people's past medical history, past, the family history. And, when it comes, I look at cancer screening. I have to put all those things
all that stuff together.
And so I always talk with my clients and say, okay, that's fine. You're going to go see a trainer, or you're going to see this person in this platform. But when it comes to in anything being introduced new into your health routine, check in with me on that, because I know some things that they don't know. I know the labs that they don't know. I know the imaging that they don't know. I know all the things. And plus, I'm looking at your total I'm responsible for the total well-being. So before you introduce that new supplement, run a check. Let's talk about this.
Right. Why are you taking vitamin D if you're not deficient in vitamin D? So that's where we would come in, and we would run a vitamin D panel to see what was going on.
So it's so important to know the labs. It's so important to know the biochemistry.
I love that. I love that. And that's where I live in my practice is the metabolism, is the biochemistry. That's where we live. And that's what we want. We want to move the dial. Let's stay with the essential health laws. Let's talk about eating. You know why? Because I could go on for hours. You and I could go on for hours with this.
Absolutely. And I'm glad, because I wanted to get back with that. The E in the acronym MEDS. Now we're talking about eating organically. I am a big proponent of eating 6 meals a day. Breakfast, lunch, dinner, and then a snack in between breakfast and lunch, dinner, and bedtime. And when I talk about a snack, I'm talking about like things like blueberry and almonds. I'm talking about an elite carbohydrate, an elite fat, an elite protein that you'll find in almonds. And this is also helping change your numbers. When you're eating something like almonds, you're eating something that can help with your cholesterol, overall cardiovascular health, okay? Because it's a good fat and you need that. And,
absolutely.
People have to understand that all carbohydrates aren't bad. Blueberries, that's a carbohydrate, but it's an elite carbohydrate, okay? So when we talk about having a snack between your 3 main meals, we're talking about keeping your blood sugar even keeled. We're talking about making sure that you have energy to get through the day. I'm also known as America's energy doctor, and having energy, feeling physical energy, feeling like you can get up and go and accomplish your goals. That's a huge thing with me. So I'm talking about, and part of that is making sure, of course, that you exercise. We talked about the movement, but making sure that you eat healthy, eat elite. Okay. It's just like gasoline in a car. You have 3 choices: regular, super, and like super in some places, or at 93 octane. And you really want to put that 93 octane, so to speak, in your body so that you can function at a high level. I talk to people that sometimes will skip a meal here and there. And I say, no, you don't want to do that, because your body's working off that glucose. Your body's working off those nutrients so that you can fuel your body. 25% of the glucose that we intake goes to the brain. And so if you have brain fog, that's because you're not eating enough and you're not eating regularly. So that's why I tell people 6 meals. I want to keep that motor going. I want to keep their good, I want to keep them thinking positively. I want to make sure that people are ready to just get up and go and accomplish their goals. Overall, like I said in my book, The Energy Secrets to Do the Good Life, it's about doing the good life. It's about accomplishing your goals. And listen, I will say this, I'm sure we'll get on with the rest of it, but I want to say, I always tell people, usually when they have an encounter with me, what's the 5 things you feel like you have to accomplish before you leave Earth? Because if you don't have goals that you're trying to reach to, then you don't know why you want to lose the weight. You don't know why you want to have more energy. People say, I want more energy. When I'm saying, for what? Why do you want more energy? So you still have to have overriding goals that push you to make a difference and to make change in your numbers.
Let me tell you something. I am learning a lot. I am taking notes. And that question, what are the 5 things you want to accomplish before you leave this earth, is now going to be put into my consultation. I think that's great. You find out their why and what they want to do and why they want to do it at that point. And I think that's very important. And carbs are your friends. Like you said, you want an elite carb. You don't want potato chips or pretzels.
Right.
You don't want the candy.
Of course not.
You don't want that. The candy,
No,
it's an ultra processed food.
Fuel. You don't want that.
Right.
That's going to make you feel sluggish. You might feel full, but you're going to feel sluggish and you're going to pay for that.
That's
okay?
right.
You're not going to get the bang for your buck that you're expecting. And most people aren't eating chips to actually feel more energized. They're eating chips because they want comfort. They're eating chips because it's on the shelf. They're eating chips because, hey, they want something that for right now on their palate tastes good, but you got to change your palate. And you can do that by slowly integrating higher octane foods.
Fuels. And you know what? You are hitting so many points because, and I've said this a couple of times on the podcast, an article last year at this time, Mayo Clinic proceedings out of Spain, where they were getting away from that Mediterranean style type of a diet, and they were getting more into the fast foods, the ultra processed foods. They're readily available. They're right there on the shelf, as you just said. They're highly palatable. They taste good. They have the sugars. They have whatever, the salt, and they're affordable. Everybody can go out and get a bag of potato chips.
Right.
But if you're having multiple bags of potato chips in a day, that's empty calories.
Right. Yeah.
You don't want that. Now, here's another important point. The third one, drinking water. Oh my goodness, this is something that everybody can do, right?
Right.
This is something that
revolutionary, new concept. No, it's not a new concept.
No.
But here's the key. I talk and teach about it differently than most people think. So when people say, "Oh, drink water." Okay, yeah, okay, I'll drink water. Okay, all right. But no. This is what I tell people. Now, if you don't have kidney disease, you don't have heart failure. Okay, keep in mind, because that's a whole nother.
That's a whole other animal
If you have congestive heart failure, if you have renal disease, there's only a certain amount of water you can take because you don't want to overload your cardiovascular system. You don't want to put extra stress on your kidneys. But outside of those things, or any other medical, contradictions here, I tell people drink at least a liter of water a day. Listen, here's the thing, because you're getting water in all the other things that you drink, whether it's fruit juices or whatever, you're getting water in those things. So I tell people just set the goal of 1 liter a day, knowing that that's something that's attainable. That's something that people can swallow and most people be consistent with. Now,
and no pun intended, right?
Right. Well, listen, here's the thing. Ultimately, you want to have about 2 liters of water a day outside of renal disease, outside of CHF.
Absolutely.
But I realize that people are getting that fluid and extra thing. So I just try people to say, see, most people that you talk to aren't drinking water. Okay. 75% of Americans are chronically dehydrated. So I know that even though it seems very intuitive, most people aren't picking up that bottle and drinking water. They're drinking things that can really dehydrate them, whether it's coffee, whether it's soda with caffeine in it, whether it's alcohol. These things pull water out of you. And water is so important. We all know we're about 66% water, the physical makeup. And so when we talk about preventing certain headaches, when we talk about helping to prevent certain respiratory illness, certain skin issues, drinking water is essential. So I tell people just aim for that 1 liter a day. And you want to have it with your snacks, not with your meals. And this is the thing. This is where I teach a little bit differently, because I told everyone back in the E part of the MEDS acronym, 6 meals a day, snacks in between the 3 main meals. Well, drink water with your snacks, not with your main meals. A lot of times when we go to a restaurant, people are serving water, right, with the salad, with the main meal. And I say, no, that's better to have a juice. Because when we look at it, water treats, our body, treats water as a solvent and the food as a solute. So what happens is, when we drink a lot of water with our food, it kind of dilutes it and we don't get all the nutrients we could possibly get. But when we drink something like a juice, let's say orange juice, so to speak, our body looks at it in a biochemical way and says, okay, we're taking the nutrients out of the orange into our body. Okay. And even though water is part of that orange juice, but there are nutrients in that chemical makeup of the orange juice along with our food, and our digestion's actually better. So I tell people to have the water outside of the 3 main meals, get the, at least 1 liter a day, knowing that you'll most likely get 2 liters or more with all the other things that you may be drinking. That way it improves our digestion. That way we stay hydrated and we just feel more energized because we hydrated ourselves. It's so important. So that's one of the things some of the tidbits that I give people when I talk about the D in the MES acronym.
Right. And when you're talking about drinking orange juice, like you said before, it's fresh squeezed orange juice. Back in the day, you used to get it in a
I know, it's the frozen cans.
A frozen can. Actually, I'm so old. I remember it was a frozen, cardboard box that they used to get it in.
Listen, no, and me too. I remember all that.
Right, you remember that?
There was something not right about that.
Right, it wasn't. And then you would put it in the water, and you're crushing that big chunk of orange, and it was all chemicals and things. But we thought it was good because we're having orange juice for breakfast in the morning.
Or people would buy orange drink, so to speak, where it would just come in a little container, it would just be basically sugar, and then you're putting water in it and mixing it up. Right. And so obviously there's something not right about that.
Right, there's not something. And listen, something as simple as lemon water. Get the lemon, squeeze the lemon, put it in a big, glass jug.
Absolutely.
And put it in there. I do that all day long. In my offices, we have, in the fridge, we have a big jug of water, and it's got lemons in there, cucumbers in there, and we drink it all day. Whoever's the last one who drinks the last bit's got to make the next one. That's the whole thing.
No, exactly. We're talking about health principles here that really push the needle and make a difference. And that's what we're talking about. And so I have to talk to people about drinking water. It's got to be something that's got to be in the forefront of your mind, else most people will not do it. Okay. It seems intuitive, but it's not. It's not. So it's something that we have to repeat and we have to tell people. And again, my practice is all about wellness, focusing on the health principles, focusing on the health laws, so to speak, that make a difference. Water obviously is a health law. Like I said, we're 66% or so amount in terms of our physical makeup. Water, we have to drink water. So I tell people all the time. I tell people move, eat, drink, sleep, and we have to. We have to focus on this, And as we go through the rest of the acronym, I'll tell you some of the things that I do because I'm a very high functioning individual. I'm very busy. I'm always on the go. I have to be in shape.
Right. I understand. The last one is S, sleep. Right. We discussed a little bit about it, but that deep, restorative, restful sleep is extremely important because you can have the rest of them. And if you don't have good sleep, it's just not going to work. I asked a PhD in nutritional biochemistry, Dr. Brandon Marcello. He's in Florida too. And I said to him, Dr. Marcello, what's the most important part of nutrition? He sat back, he looked at me and he said, sleep. And then he went into an hour of why sleep is extremely important.
Yeah. Oh my gosh. Listen, it's so important. And, like I said, you really have to find your sleep number. You have to make sleep specific to you. Okay. Everyone is not the same in that. And you don't have to get envious of your friend just because they're high functioning on 4 or 5 hours. Okay. I'm not saying 4 or 5 hours is the best. I think people should at least get between 6 to 9 hours. I know some people who get 10, but if you're in that range, that's good. And here's the deal. Here's the deal with sleep. The number one thing in terms of challenges that I hear from my patients and clients about sleep is racing thoughts. Okay, that's the number one challenge that people have. And so when I talk about sleep hygiene, when I talk about helping them to overcome that, I talk to them about several things. And some people are like, some of the things I tell them is like, they're out of the box that they take them back a little bit. But one of the things I tell people, like, okay, you're having racing thoughts, so kick the TV out of your bedroom.
Oh, yes.
Make your bedroom like a spa. If you've ever had a massage before, there's not a TV in that massage room. Nope, they have some type of organic.
Yes.
The lights are down low, so you can relax. And immediately when you get in that atmosphere, you kind of exhale, so to speak. So when I say, hey, go kick the TV out, people are like, no.
They freak out over that.
Wait a minute, but you're not getting sleep. You're not getting sleep. Yeah, kick the TV out. So if you're having racing thoughts, you have to kick the TV out. Plus, I also tell people, listen, also, this is where journalizing comes in. You have to listen, you have to make sure that you journalize and put an answer to some of those racing thoughts. The mind can actually deal with a possible solution, even though it might not be the exact solution, to make a difference and to help you to just relax and get sleep. I have a journal that I use by Dr. Stacia Pierce called the Success Journal, and I journalize my next day because it puts into the racing thoughts. It gives me a possible solution because I've thought about it. I've chewed on, what's a possible solution to this? And then I write it down, close the book, I go to sleep, and it makes a world of difference.
I love that because it settles your mind down. Now you have those thoughts that are settled because, like you said, it's a possible solution. It may not be the solution, but at least you've started, right?
You started going instead of worrying. See, what happens is when you don't concrete your thoughts, you just mull over it. You worry, and it keeps people up at night. I tell people that it's almost like if you're looking at a pond and it's a serene pond, that's how you want your mind to be. But if you've ever stepped close to a pond and scared a frog into a water, and all of a sudden all the ripples start happening, well, that's what happens when thoughts that you can't control or you can't stop. You just have all these ripples, and you can't let your mind go from alpha to beta, to theta to data, to delta, so to speak, so that you can get in that deep restorative sleep. And you have 100%. To be able to control your thoughts, put potential answers to your racing thoughts, close the book, go to sleep.
Go to sleep. Because what happens, and I can, with my own life, you're going through a tough time or whatever, you wake up at 2:00 in the morning, your thoughts are racing. If you don't journalize and you don't settle that down, by the next morning you're exhausted. But then you're so exhausted that you don't even know what to do to get out of whatever challenge you're faced. Or if you set a goal, people set New Year's resolutions at this point in time.
Right.
So you're just like hitting up against the wall. You just don't know what to do. Journalize and then settle it. And then the next day you'll probably have a better answer, or maybe you'll start acting upon what you thought about. Yeah. Because, in my own life, I sit there and I wake up in the morning. It's like, okay, I got up at 2, I'm up till 3, I'm up at 5:30, which I normally am.
Right.
And I don't know where to go now. I'm so tired.
Right.
And also put this away. Put this away.
Exactly. You got to put the phone away. You got to put the phone, listen, that's what people have to understand. They have to disconnect. They have to unplug from that. I know people want to see what their friends are doing on social media, and they want to check, the latest scores or whatever, and they don't get sleep. They don't take that valued time to invest in themselves and get the restorative rest that they need. It's so important. Like I said, I tell people all the time, you have to prioritize sleep. With me personally, I don't usually wake up to alarm clock. I wake up when I wake up. That's just me. My schedule's a little bit different. And I get, when I measure it out, I get between 8 hours, 9 hours of sleep. But when I am up, I'm ready to go. I'm having creative thoughts. I'm being productive. I'm healing people. I'm helping people. And it helps me to stay fast paced, on the go, on the move, energetic, and really have
100%. And you know what? If physicians are telling you to do this, you should take that recommendation, because if we're doing it, then it's something that's definitely going to work. And what was the name of that book that you
Wellspring, The Energy Secrets to Do the Good Life? People can find that on my website at jasonmd.com. They can get it in an ebook version, or they can get it in the hard copy version. And, it'll change your life, because again, I am very, like I said, we talked about earlier on the show, very principled centered. I want to help people focus on health principles that will push the needle, change their numbers, so they can live an exciting, energized life.
And you know what? Tell me about your day. Tell me about your routine. How do you apply this to your life?
Like today, when I woke up, I always spend quiet time. I'm a Christian, so I spend time in my Bible. I spend time praying.
And you pray. Correct.
And then what I do is, like today, I have a trainer. I had a trainer come to my house. We did our stretch routine. And I'm a big proponent of stretching. Of course, I told you about cardiovascular exercise, but really under all of that platform is having good flexibility, feeling long so you can prevent injury. And so we went through an hour stretch routine. Then I went out for my walk. Okay. Then I came home and ate breakfast and, got ready for the day. And so that's my routine. But one of the things that like I do is making sure after I got the 8 hours of sleep that I hydrate. And so as I'm walking, I'm drinking water. I'm staying focused. And see, as I go through the day, I'm getting calls from my patients, news opportunities. I have to prepare to be in front of the camera. I have to prepare to be in front of my patients. I have to prepare to run meetings. I have to prepare to go ahead and really just be at the top of my game. I have to critically think. I'm always critically thinking. Not just that, I have a family. I have to take care of my wife, my daughter. I have to take care of the things that we're doing at home. So I'm multitasking as I'm going through the day. Not necessarily multitasking at any particular moment. I'm focused on what I'm doing, but I have so many things in terms of so many different avenues that I have to be responsible for. I have to feel energized. I have to feel physically fit. I have to feel strong. I have to think positive. I have to be ready to overcome anything that comes my way. And so making sure that I move, eat, drink, sleep, making sure that I'm not putting any junk in my body. I'm not putting sodas in my body. I'm not putting, any type of starchy, deflating food in my body, but that I'm just ready to move, ready to make quick decisions. That is the paramount in my life.
Yeah, I think that's great. And it's so difficult because once you start going down that road where you're eating those processed foods, we could talk about omega-6 fatty acids versus omega-3 fatty acids. Omega-6s bring down that inflammatory cascade. You don't want to eat that fast food. You know what, Dr. J? And when I say Dr. J, it always reminds me of one of my favorite basketball players.
Right. Yes, Doug, right?
He played for the Nets and we loved him, and then he went to the hated. I'm in New Jersey. Went to the hated, Philadelphia 76ers, and that was it. It was bad at that time. So I remember when I first got into practice, which was almost a little over 30 years ago. It was a different time. We had 3 offices. It was busy. And I started to eat poorly. And I can tell you, I gained 50 pounds.
Wow. And
I could tell you that my cholesterol was 500 back then. And that was the big biomarker. That, back then, my triglycerides were 1,227.
Wow.
And I was told within a week period of time that I'm going to die. And I didn't have movement. And I wasn't eating right, and I wasn't drinking water. That was replaced with sugary colas. I wasn't sleeping because even though I had partners, it was busy. So I'm like, okay, I have to go here, then I have to go here, then I'm going here, then I got to go back to this office. And you just get into a rut. So, but the thing is what we're talking about for all of our listeners. You listen, you come in and you have the consult with Dr. J. He's going to help you out. He's going to put you on that path where you're going to be more healthy, and it starts from here up. It starts from the neck up too, because if you're journaling and you're doing all of that, you're figuring it out, if you will, right? And it's important to start from the neck up. Is that a fair statement?
Absolutely. And that's how I started my book. The first third of the book really talks about your mindset, and it really talks about those 5 goals we talked about. And I want to just over deliver in this, and I don't want to take up all your time, but I want to say this, it really does start with having those 5 goals, knowing what your overriding goal is. I had a patient earlier on in my career who was a farmer, and I talk about this patient in the book where, they were overweight, they were depressed, they were a smoker, they were a farmer, and I practiced medicine in a rural community at that time in Michigan. And so what the deal was is that this person came into my office. I said, look, how long do you want to live? I looked them right in the eye. I said, how long do you want to live? And it just took them back. And they were like, what are you getting at, doc? I said, look, if you keep on this road, you're not going to get to your goal. I said, how long you live? He goes, I want to be 95. I said, no, you're not going to make that. 85? Nope. 77? 65? The guy was 55. I said, yeah, possibly, we could possibly do that. He said, what are you getting at that? He said, look, if you don't change things, you won't get there. He went out of the office. He might've been a little pissed. Comes back 3 months later for a follow-up. The person had changed his numbers. And
he's ready to go. Right.
Gives. And he said, when you asked me how long I wanted to live, I thought about, now this, I told you it was a farmer, but that wasn't the thing that got him going. He said, I thought about my grandchildren. And I said, I wanted to be 95 so I could be there for them. And I realized that this guy had an overriding goal that caused him to want to make changes in his numbers when we had that sit down talk. Mm-hmm. And that made all the difference. So I always start there with people. You have to have goals that you're pushing for, else you're not going to make changes. You're not going to make these small changes to get to those overriding goals. And here right now with the whole pandemic thing going on, people, and look, I'm not saying anything negative about the vaccine, but I am saying this. Some people's faith are 100% in the vaccine. Okay, nothing wrong with getting the vaccine, but I will say this.
I agree, right.
If you don't work on your health principles, if you don't work and take certain responsibilities in terms of exercising, moving, eating, drinking, sleeping, keeping yourself healthy, then, and you don't support your immune system that way, then, and you put it all on a vaccine, you're putting yourself really in a narrow window, so to speak, and you have to make sure that you're doing those other things to keep your body healthy. So along with the vaccine, you're doing everything that you can to be in the best shape to fight infection and to be healthy and to be energized.
Yeah, you know what? You're hitting it, because when you mentioned the pandemic, and I was going to bring it up, some of the research that's coming out of the New York hospitals now is that, hypertension, cardiovascular disease, hypertension, asthma, hypertension, type 2 diabetes, hypertension, obesity, hypertension, autoimmune conditions, things of that nature. That is leading to what we would say in science as a poor outcome, right? And so those conditions that we're mentioning, even though they have that genetic component, you're not your genetics 100%, but you can take some of these positive lifestyle changes that Dr. J's talking about and lose the weight and get those blood chemistries, those lipid panels normal, right?
Exactly. I mean, that report that came out in August by the CDC talking about 96% of people who had serious morbidity to COVID-19 had 2 or more comorbidities. So if you can work on improving those comorbidities, you have a better chance of doing well. If you were ever to get the flu, if you were ever to get COVID, if you were ever to get any type of respiratory illness, if you work on yourself in those ways and don't just put it all on interventions such as the vaccine. I'm not saying don't take the vaccine. I'm just saying that you can't put all your eggs there. You still have responsibility as far as your movement, eating, drinking, and sleeping. And when you do those things, you put yourself in a better situation. The vaccine won't work on your hypertension. It won't work on your obesity. It won't work on your cardiovascular disease. That's your responsibility. And when you do those things, you put yourself in a better platform, better situation.
You and I are thinking in parallel universes, because if you want to take the vaccine, that's fine. However, you also need to take a look at your lifestyle.
Yeah,
that may make
you still have to take responsibility. You still have to take responsibility. So I always tell people that, and it just makes a world of difference when people take ownership of their health and go that extra mile to make sure that they're focusing on the principles so they can live a long life.
Right. And you know what? When my cholesterol was that high and my triglycerides were that high, I remember in the hospital ER, the ER was right across the street from my office. And all I can say is my blood pressure was 220 over 110-ish when I walked in. And I remember an orthopedic surgeon that I referred to was just happened to be walking through the ER, and he looked at me and said, "Dan, you're going to die." And all I can say is when I was lying down, I looked at my stomach and I went, wow. I said, this is not the way you're supposed to live life. And when I found out my triglycerides and so forth, because really those levels is a point of no return, to be honest with you. Right. I mean, it was in my late 30s. So it's like 37 years old when I had this. That's just crazy. I remember my wife coming in. And I looked up at my wife and I said, I literally yesterday just paid for the insurance. So you're going to be rich no matter what happens, honey. She wasn't too happy with that. So pandemic, we need to, I think the one thing we're not talking about is coming out of this more healthy, right?
Right. I mean, this is where people should look at themselves and figure out what changes they need to make. Now, I just think that if people focus on those 4 health laws we talked about, move, eat, drink, sleep, and push the needle, work on themselves, stop comparing themselves to their best friend, stop trying to look a certain way for superficial stuff, but instead push the needle so that you can feel better, you can be healthier, so that you can have less sickness, less time off work. If you focus on achieving those goals, you're going to be more happy, you're going to feel better, you're going to feel
100%.
stronger. You're going to feel it. When you make changes in your number, you feel it. You feel better. You feel like you can take on new challenges. And that's what we want people to do. We want to empower people so that they can be healthy. Listen, some people are like, when it comes to medicine, like, all I got to do is take a pill. No, you want to get to the point where you don't have to take any pills. Supplements, vitamins are good things, because when we talk about our foods in today's situation, not all foods have the premium amount of supplements that they used to have. And so, supplements are good. Make sure that this is where you can still do biochemistry analysis labs, so to speak, and find out what supplements you need. I'm a big proponent for that.
Yep.
But here's the deal. You do want to get to a point, unless you have something serious, like, you've had a heart attack, you've had stenting done, you have to be on aspirin and Plavix. I'm not talking about coming off certain things like that. You got to listen, you got to talk to your doctor, no doubt about it. Obviously, I'm a primary care doctor. I want all my patients to check in with me. And I also tell people, you want to check in with your primary care doctor when it comes to making big decisions in terms of supplements or medications, whether to stay on medications or to come off medications. You have to partner with your doctor on that. And it should be a team effort. You can't make these offshoot individual decisions and not run it by someone who has expertise, such as your doctor, before you make big changes like that. So look, I check in with my trainer, I check in with my doctor, even though I am a doctor, and I make changes so that I can live a healthier life in a safe and educated way.
That, I think, is also very important. You're held accountable by your doctor, even though I'm held accountable by my doctor. So that they're telling me what to do and what not to do. As a matter of fact, I'm seeing Dr. Fluxina later on today, where we redid some blood work, and we're going to go over it. So I need it also, to make sure that I'm right.
Exactly. And that's about having that objective eye, having someone to push you, having someone to make you better. I have someone who stretches me, and you know what that's about? They can stretch me further than I can stretch myself. So, again, you do want someone to partner with you to help reach your goals.
Help you out. That's what we're here for. We're almost done with the hour. I feel like we just started.
Yeah, listen, we can talk forever. I mean, we can go on so many different avenues.
Yeah, and you know what? For all of our listeners out there, I'm going to ask Dr. J to come back on in a couple of months, and we'll pick up from where we're leaving off right now, because we're having a great conversation. I'm learning. I'm taking notes all over the place right now. And, I hope that all of our listeners go back and listen to this podcast again, because Dr. J is really hitting a lot of great points. Now, one more question. Is there anything else that you want to say? Anything else that you can think is important?
What I really want people to take away from this is to really focus on pushing the needle and making a difference on those 4 health principles, laws, so to speak: move, eat, drink, sleep. I want people to make sure that they're investing in themselves. I want people to know that, there's something that you can do. When we talk about being in the middle of a pandemic, we talk about COVID-19. There's a lot of fear. There's a lot of anxiety about that. I talk about COVID-19 all the time on the news. And the one thing that, as I'm out and about, I sense people being afraid. I sense people being anxious. So what are you going to do about that? What things are you doing right now in your health to make a difference, to get a sense of control over this thing? You're not powerless. So I just encourage people to go ahead and make sure that they're moving, that they're eating, that they're drinking, that they're sleeping, that they're putting elite foods in their body, that they're doing what they can to accomplish their goals in life, to be energized. And listen, take a buddy with you, encourage somebody else.
Great
Cheer
idea.
somebody else on. Helps. If you think you got it all together, then encourage somebody else. It could be a family member that if they don't hear from you, if they're not encouraged to healthy living, you know, they could be in a bad spot when it comes to COVID-19 or something like that. But if you partner with them, you can make a difference in their lives. So that's what I really wanted to communicate with people today.
I absolutely love that. I absolutely love that. Thank you very much for being on, Dr. J. How can individuals contact you? How can they purchase your books? We're going to talk about other books in future podcasts.
Absolutely.
You and I.
Very simple. Now listen, I have a couple of books on my website. I have Energy to Go, which is a download that you can go to jasonmd.com. You can get Energy Wellspring, the Energy Secrets to Do the Good Life on that website as well. And you can see all the other things that I'm into as far as the news, social media. You can get to my social media links from there. But if you want just a quick link to my social media, Instagram, just go to Dr. Jason Littleton. Facebook, just go to Dr. Jason Littleton. And if you don't remember that, just go to jasonmd.com and you can find the quick links to get to those spots. And I look forward to seeing all you guys on social media and out there on the internet as well.
Yeah, you know what? I'm going to have all of that in the show notes. I recommend Dr. J. You got to contact him. You know, he's going to help you out 100%. So thank you very much for being on today. It's been a great conversation.
Thank you, Dan. I really appreciate it.
Yeah, it was a really good time. So I'm Dr. Dan, and I'm at suburbanwellnessgroup.com, greenleafbewell.com, 973-483-2277. Thank you very much, Dr. J. It's been a great conversation. We're having you come back on. We got a lot more to discuss. I want to thank everybody for listening. Our podcast is growing because we have Dr. J on. And, you know, like we said, we have the best of the best of the best. Here it is. So thank you all for listening. Thank you, Dr. J.
Thank you.